The objective of the study was that research investigates how U.S. higher education institutions' financial reliance on international student tuition influence their decisions to respond for in-person or hybrid learning during the early stage of the COVID-19 pandemic. The article focuses particularly on the context of July 2020, when ICE, Immigration and Customs Enforcement, announced policies that would have barred international students from staying in the US if their coursework was fully online. The theoretical framework was the study uses resource dependence theory (RDT) as its main lens. This theory posits that organizations adapt their behavior in response to external dependencies, in this case, tuition revenue from international students. Institutions that are more dependent on this revenue might act in ways that ensure continuity of the resource, even if such decisions come with health or political risks. Institutional behavior and data. Using institutional level data from over 2,000 US colleges and universities that authors analyze reopening plans across different types of institutions. They categorized the reopening strategies as their full in-person, hybrid, mix of in-person and online, and fully online. Eh, the data were paired with enrollment statistics, especially the percentage of international students, to explore whether this influenced reopening decisions. Mm, Key findings: one, uh, private non-profit institutions were significantly more likely to offer in-person or hybrid instruction. These institutions tend to rely more heavily on international student tuition, making them more financially vulnerable to losing those students if instruction remained online only. Two, public institutions, in contrast, were less likely to reopen in person and were more likely to follow state or public health guidelines. Their decisions were not as strongly influenced by international enrollment levels. Three, institutions with larger international student populations were more likely to offer face-to-face or hybrid instruction, suggesting that economic concerns about retaining these students influence their pandemic response. And four, the place context, like ICE's proposed visa rules, also shape institutional strategies, indicating a political pressure dimension that interacted with financial concerns. Mm, the balancing risks and priorities, the authors urge that these reopening decisions reflect complex trade-offs. For example, one on one no, on one side, the need to maintain tuition revenue, especially from paying international students. On the other, risk to people health, institutional values, and equity. In some cases, these decisions may have compromised safety for the sake uh, of financial survival. The implications are the story exposes the vulnerability of higher education institutions that depend on tuition from international students, especially in times of crisis. It calls into question the sustainability of such dependency and advocates for more resilient, diversified funding models. Policymakers and educational leaders must reflect on how external pressures, financial and political, can influence decisions with long-term consequences for students, staff, and communities. And it also raises questions about the ethical dimensions of institutional decision making, particularly when public health is at stake. The conclusion is this research highlights the interplay between financial needs, immigration policy, and public health considerations in shaping institutional responses during COVID-19. It provides evidence that international student enrollment was a key driver behind some universities' decisions to reopen, especially in the private sector. Ultimately, the article serves as a warning about the risk of overdependence on international tuition and the need for more robust governance and funding structures in higher education. Thank you.